Welcome, everyone, to a late night episode of the Theology Central podcast. It is Thursday, July the 2nd, 2020. It is 10:43 p.m. Central Time. Now, you may hear in the background what sounds like gunshots. That's not gunshots that you hear. Someone has decided at close to 11 p.m. on a Thursday night to, blow up every type of firework that you could possibly purchase. So it's been going off. The dogs have been barking. So if you hear that, I apologize. I am home. I'm not at the church. I'm in my study. And where I have to set up the microphone in my study is right next to a window. And somewhere nearby in one of these big open areas filled, for those who don't know, I'm broadcasting to you from Abilene, Texas tonight. Someone, I guess, has purchased, maybe $100,000 worth of fireworks, and it's just like boom, 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 boom. So it started slowing down, and I thought it was over. There was one again. There they go again. Okay. Yeah, I can go stand in my back porch and just watch them. So it's a free fireworks show here in West Texas tonight. So that is going on. And, there's been a lot of fireworks today. Wow. If you heard my last episode, let's just say that set off some fireworks. I have received some not so nice messages telling me that not saying some nice things. And yes, I was very passionate. Is that a good word? I was very angry. I was very upset. I was mad. And I feel that I had a right to be upset and to be mad. When you turn on Christian radio, and when you turn on Christian radio and you hear someone in the name of God, in the name of Jesus, handing out misleading to downright false information, clearly withholding information that would have been like, hey, here's what OSHA said. But no, that's what someone who you claim works for OSHA said. You didn't even give us his name. And when I go to the OSHA website, it says completely different. No, you're misleading. And all of the misinformation, all of the fraudulent information being handed out on Christian radio today was dealing with wearing a mask during a pandemic, the COVID-19 situation that we're all living through. And when I heard that, I got upset because while that was going on, we were getting messages like, hey, the number of COVID cases are exploding all over the place. We're breaking records everywhere. And then here in Texas, we were just about, that program aired on Christian radio at 1 p.m. And by 3 p.m., 3:30, 4 p.m., my house phone was ringing, claiming, telling me that the, medical emergency system was, had been activated and that we were to wear, if we will leave the home, wear a mask and basically stay at home unless you need to go out in public. And then Governor Abbott did basically a press conference telling everyone, hey, you got to wear a mask now if you go in public. And then it was like, and then all these cases are happening here, things in the local area of Abilene, Texas. The big 4th of July celebration thing was canceled. And it's just like all these things were happening. A large church in Abilene announced that they were closing down for the entire month of July. All of this was happening. And while all of this was happening, Christian radio was spending the time saying, not praying about the situation, not calling for Christians to repent, not calling for churches to really focus on people's spiritual life. No, they decided that this was the time to go all in, telling people not to wear masks, that the masks are absolutely useless, and implying that they could be actually detrimental to one's health. So in that episode, everything they said, I checked out from John Hopkins, the Mayo Clinic. I went from source to source. I was citing the sources, and it just became, it just created enough anger in me that I wanted to scream. And I just can't believe that that's the way Christian radio is handling itself. And let me make it very clear. This entire situation, from a Christian perspective, is very easy. What we care most about is following Scripture. What we care most about is following God. And we have a very clear mandate that how the Christian should the Christian should proceed. We should proceed with demonstrating that we love our neighbor, that we love other people, that we place other people before ourselves. That's a very important principle that Christians must follow. Another principle that we must follow is that we believe all people's life is sacred. There is sanctity to human life, and we should do everything in our power to preserve that life and to protect that life, because we have a clear command, thou shalt not kill. So I don't want to do something that could possibly bring about the death of another human being. That is clearly something a Christian should not do, and we are commanded, we are told, thou shalt not kill. I don't want to be responsible for doing something that could hurt, injure, or kill another person. We are in the middle of a global pandemic. I know that's redundant, but a pandemic obviously is global. It's going around the world. Here in the United States of America, the cases are continuing to rise. America seems to be losing control of the entire situation. And in the midst of all of this, Christians are not looking at, what can I do to show love for my neighbor? What can I do to demonstrate that I care about other people? What's the best thing to do here? And as I stated in the episode earlier today, even if the masks were only 10% effective, well, then we should at least do everything in our power. So I'm not going to repeat everything I said, but I talked about that. I got upset, created all kinds of fireworks. And again, it did because I was going after Christian radio for their approach. This is not talking about how the world thinks. No, because I'm looking at it from a theological and biblical perspective. So all of that's done. I sit down tonight, I have some pizza, I'm relaxing, and I'm like, oh, I've got some notifications on my iPad for some podcast episodes. And I hit play on one of the podcast episodes, not produced by a Christian ministry, produced by the world. And, they're talking about COVID-19. And they basically state is the debate about the mask for COVID-19, is that debate over? And I'm like, wait a minute. Is the debate over? Clearly, you guys aren't listening to Christian radio, because in Christian radio world, I don't know. I guess you could look at it in the Christian world, or at least on that particular Christian radio station. They think the debate is over because they have drawn the conclusion that masks are absolutely useless. Now, here's a secular radio station saying, well, is the debate for the COVID-19 mask, is it over? Now, is it over in what way? So I grabbed the audio and thought I would play it. We would at least listen to it. So this may kind of just add to the discussion that we had earlier today, may bring this to a full circle, maybe add a different, we got the Christian radio perspective. Let's listen to a secular radio perspective. This is a podcast produced by NPR. And it's interesting where they start this episode. They're going to start by taking us to Fox News, which is kind of interesting. Let's listen and see what they have to say and see if we can just bring some of this discussion to conclusion. And maybe, I think I'll make this through this a whole lot calmer than I did. This afternoon. So here we go. Let's listen.
If you were watching Fox News on Tuesday morning, something we know the president does a lot, you might have heard something new from the top Republican in the House, a key ally of President Trump, Kevin McCarthy.
Wearing the mask is the best opportunity for us to keep this economy open, keep us working, keep us safe, and help us as we build towards that vaccine.
Fox and Friends co-host Steve Doocy said, yeah,
sure. And Leader McCarthy,
masks do seem to help. Doesn't that mean the president should wear one in public?
I just don't see any downside in the president being seen more often wearing it.
More Republicans are speaking up in support of wearing masks. Sean Hannity did it on his show recently.
I think they work. And I said, especially if I wear a mask and it opens up baseball, concerts, NFL football, I'd rather wear the mask and go to the game to protect Grandma, Grandpa.
Senate Majority Leader Mitch McConnell tweeted this week, we must have no stigma, none, about wearing masks. And now, more than 3 months into a pandemic that has killed more than 100,000 people in this country, the message is morphing even more. Masks don't just help, they're American.
Obviously, it's patriotic because you're not only protecting yourself, you're protecting other people. I've heard that there are people around the president who say, no, you shouldn't wear it. But nonetheless, it would be a powerful symbol.
It would. I mean, for the 4th of July, we could all show our patriotism with a red, white, and blue mask going out there.
Great idea.
Surgeon General Jerome Adams on Tuesday.
This face covering actually is an instrument of freedom.
Said something similar.
It adds to your convenience and your freedom because it allows us to open up more places and it allows those places to stay open.
And even Vice President Mike Pence has been wearing a mask in his public travel lately.
Wear a mask whenever your state and local authorities say it's appropriate.
But still, the head of the Republican Party, President Trump, has long been skeptical of masks. He's even refused to be seen in one, saying at a Ford plant in May he didn't want to give the media the satisfaction.
I wore one in this back area, but I didn't want to give the press the pleasure of seeing it. But no, where I had it in the back area.
Whatever the president does, his political allies and many administration officials are turning up the volume about the importance of masks and other public health measures. A recent poll by the Pew Research Center found that 76% of Democrats said they wore a mask all or most of the time in stores or other businesses in the past month. For Republicans, the number was 53%.
Let me stop right there. From the Christian perspective, the biblical theological perspective, wearing a mask should not be a political issue. It's not something to make a political point. It shouldn't matter if you're a Democrat or a Republican. And it's just interesting that some of that discussion there about the mask being patriotic, that goes right back to 1918, during what was called the Spanish flu at times. That outbreak, it became, hey, if you're patriotic, you'll wear a mask. It's just interesting that that's kind of coming back a little bit. But it's just ridiculous that the mask became an issue. Well, you know what? I'll take that back. It makes perfect sense that in the world, it turns into an argument about politics and it gets into a discussion there because they don't have a theological perspective. They don't have the perspective that life is sacred and that we are to love our neighbor and to think of others before ourselves, and that the command for us, thou shalt not kill, goes beyond just not killing. It's a command for us to preserve and protect life. This is the biblical perspective, a biblical worldview. The fact that Christians got pulled into that and was all over social media arguing back and forth with conspiracy theories and false information, and is on Christian radio like today, giving out wrong information and misleading information. That is an indictment upon Christianity and an indictment upon the church. But it's interesting that it sounds like the tone is changing, right? So, President Trump, nope. Not going to do it because he's got to make a point. He's got to prove a point. People are dying. You don't make a point while people are dying. And for the Christians who are going to well, no. Do you care about life? That's the issue. All right, let's see what else they have to say here.
Dr. Anthony Fauci talked to NPR about this today. He said the signals being sent by these senior Republicans and by the vice president are good.
I'm very encouraged by that. I think it was very important to see senior leaders and to see the vice president out on his trip when he went out to some of those states to wear the mask.
Fauci also talked to my colleague Mary Louise Kelly about how it's going with vaccine development, about why convincing people to wear masks is so tough, and why the surge in cases as states reopened was caused in part by not enough people wearing them.
What we did see were people out there congregating in bars, congregating in crowds, in people getting together in a celebratory way, understandably, because they felt cooped up, without wearing masks. That is, in many respects, if I might use the word, it's a violation of the principles of what we're trying to do. And that is the social distancing, the wearing of masks. Because we can actually make this happen in a way if we let public health measures be a gateway to opening up as opposed to an obstacle. And if you do things that essentially enhance the outbreak, then you're part of the problem. You're not part of the solution.
Does there need to be more of a coordinated federal plan? Do there need to be requirements? Or is it wise to have the strategy remain, leaving this largely to states and local governments to figure it out?
You know, Mary Louise, you bring up a good point, and there's a lot of argument about that, about how this country is set up, where you have the states that have the capability of making decisions because of the different and peculiar nature of things that go on in different states.
From a public health perspective,
exactly,
would it be better if the federal government were taking a more assertive role?
Well, it might not be. I mean, I'm one that does take an assertive role. If you hear what I say whenever I'm talking, as I am on this program, you know, it is really saying that we must do these things. Hopefully, and I'm seeing it right now after yesterday's numbers came out, that many of the governors and the mayors are actually demanding and saying it is mandatory now. If you're going to go out, you have to have a mask on. But you're right. There will be arguments. I'm one for a more directive way of doing things. But in many respects, that's not the way this country works.
Oh. And may I just push you on your hope that we can turn things around, turn these numbers around without shutting down at least as aggressively as things were in March and April? I'm thinking of another thing you said in your testimony yesterday, which is that you were talking about why Europe has largely succeeded and the U.S. has failed to control the virus. And you talked about how when the U.S. shut down, it was in reality only about 50% of activity was really shutting down, whereas in Europe it was more like 90 or 95%.
Yeah.
I mean, that makes it sound like we had a shot and we blew it.
Yeah, I would, that's a very provocative word, blew it. But certainly, if you look at it, and I meant it, the numbers are true. If you look at the Europeans and look at what they did and what their curve, they got the curve way down. If you never get the curve down, and if you look at our curve, it peaked, it came down a little, and then it stayed about flat until just recently when it resurged up again. So we were in a bad position because of what happened early on. You're right. We only shut down about 50%. That's in the past. What we got to do now is we can get control of it if we do the things that I spoke about at the hearing yesterday.
Let me turn you to vaccines. You have said we should have a vaccine by the end of this year, that with production ramping up next year. Whether that vaccine works and how long it may work for, whether we may be protected for life or just for a few months, are those still open questions?
They are, because right now the one thing that is going well is the procedure of multiple different candidates. And there are candidates all over the world. There are several that are being looked at here in the United States with variable degrees of help from the federal government. And as I've said, say it again, Mary Louise, there's no guarantee that you're going to get a safe and effective vaccine, but the early indications from the trial make me, I use that word, cautiously optimistic that we are on the right track.
I join you in hoping that we stay on that right track, but I have to ask, what if people won't get it? You'll have seen the same polls I have showing that half of the U.S. is reluctant to get a coronavirus vaccine.
Yeah, and that gets back to another thing that we've spoken about, that there is an anti-vaccine type of an attitude, and even an anti-science attitude, anti-authority, like why are these people telling me that I want to get a vaccine? I don't trust it. It is up to us to mitigate that by getting a very strong degree of community engagement. And when I say engage the community, I get people who look like, act like, feel like the people that you're trying to engage so they can trust them as one of their own. It was very successful with HIV. I hope we can do the same engagement of the community with COVID-19.
This is interesting, and let me stay here for a minute, because you are right. The federal government has led all kinds of successful public health campaigns to do with HIV and safe sex. I'm thinking about seatbelts and that we should wear them, thinking about healthy eating. Why has it been so hard in this case to help Americans understand if we want to slow the spread of the coronavirus, there are these guidelines and we all have to follow them?
You know, Mary Louise, it's a complicated issue. I've been involved with viruses now for the last 40 years, dating back to the beginning of HIV. But I've never seen an emerging virus that has such a broad range of almost contradictory manifestations, where you have 20 to 40% of a population get no symptoms at all. And then there are those who get some modest symptoms, some get sick enough to be home for weeks, and some require hospitalization that might require intensive care, intubation, ventilation, and death. So when you're trying to explain the risk and the seriousness, you're explaining it to younger people who say, wait a minute, so many of my friends, they get infected, it doesn't even bother them. We've got to convince them. You can't think of it only as yourself. You've got to think about it as your societal responsibility. But that message is very difficult to get across.
Do you ever get tired of trying to persuade people to do what you as a scientist know is in their own best interest?
No, I don't. I don't get tired, Mary Louise, because it's such an important problem, and people's lives and depend on it, their health, particularly the vulnerable. And that's how you judge society. How do you care for your vulnerable? And there are people who are very vulnerable to serious consequences. And that's what I mean. And I'm not blaming, and there's no reason for that, because people do it really inadvertently and innocently. So when you see people devil-may-care at bars and crowds not really caring, I think about what the consequences of that might be for the vulnerable people. But boy, that's a difficult message to get across.
Dr. Anthony Fauci talking to Mary Louise Kelly. If you're looking for data about the virus and how it's spread.
Now, I want you to hear that. If you listen to what I played from Christian radio today, which I played their entire segment, I did not cut any of it out. They never talked about societal responsibility. Now, I want you to understand, the Christian program did not talk about our responsibility to other people. A secular program dealing with someone not looking at the world from a Christian perspective or a biblical perspective is talking about our responsibility to other people. But on the Christian radio program, who cares about other people? We're not going to even talk about our societal responsibility. When you turn on Christian radio and you don't hear love your neighbor, your responsibility to those who are, the vulnerable in society, caring about other people, putting others before yourself, doing things that maybe you don't necessarily agree with or like for the good of other people so that you don't cause other people to stumble, and that not using your liberty in a way that could hurt other people. All of these biblical concepts, when that's not even mentioned on Christian radio, and you turn on secular radio and they don't use the biblical terminology, they don't use the Bible verses, but they talk about our societal responsibility. Now, here's the weird thing. From a secular materialistic worldview, they don't even have a basis for societal responsibility, because it should just be, well, we're just evolved animals. Everyone just look out for number one, and that's all you should care about. They don't necessarily have the worldview to carry that idea, but they're arguing for that idea. On Christian radio, where they literally have the foundation for that kind of worldview, they have abandoned it. It's this weird world that we live in. I don't know what has happened. It's like the world now cares about justice and equality and right and wrong. And they want to speak about this behavior is right and this behavior is wrong and people should be treated a certain way. And they want to bring all these moral concepts that require a transcendent morality and require that human life has some kind of dignity and some kind of value. But they don't really have the worldview to really make those arguments. But in the Christian world, instead of making the arguments for creating the image of God, morality, transcendent morality, all of these deep concepts that we have the foundation to argue, no. We get into arguments about politics and we sound like we've been listening to Alex Jones. It's like, what has happened to the church? When you have to go to the world to get a better biblical argument than you can get in the church, you're in trouble. And again, I'm not saying every Christian or every church or every Christian radio station is that way. I'm just saying it's a big enough problem that it's becoming more and more noticeable, and it has to be addressed. But this program, this podcast from NPR, it didn't stop there. That one aired yesterday. Now I've got the clip of what aired today. All right, let's listen to it.
Yesterday on the show, you heard Dr. Anthony Fauci tell NPR how important masks are. Another thing he said, though, is that the government itself hasn't always done the best job communicating that. My colleague Ari Shapiro has been looking into this, and he's going to take it from here.
Here's a tweet from what feels like another world, late February of this year. Quote, "Seriously, people, stop buying masks. They are not effective in preventing general public from catching coronavirus, but if healthcare providers can't get them to care for sick patients, it puts them and our communities at risk." The person who wrote that tweet in February was the Surgeon General of the United States, Jerome Adams. And the mixed messages didn't end there.
Let me just say one thing, though. The most important thing is the social distancing and washing your hands.
Exactly 3 months ago, April 2nd, Dr. Deborah Birx confirmed reports that there was debate within the Trump administration about whether to recommend masks.
We don't want people to get an artificial sense of protection because they're behind a mask. And so this worries us, and that's why the debate is continuing about the mask.
Of course, today we know both things are true. Masks are not perfect, and also they do prevent people from spreading the coronavirus. Even Vice President Mike Pence recently started wearing one. So why were Americans told they don't work?
Well, it was, I think, a lot of confusion about what you mean by work.
Dr. Anthony Fauci told my colleague Mary Louise Kelly there was a lot the experts didn't understand early on.
I think what was really, I think, miscommunicated was that they're not perfect. It isn't like there's 100% protection, but one of
we
the
were told, if I may, sir, by the Surgeon General, stop buying masks. They are not effective in preventing the general public from catching coronavirus. That's what we were told. That's a tweet from him, February 29th.
Yeah, I know. I don't want to go back and analyze the tweet, but to tell you now the data that we have right now, one of the things
Fauci said back then the experts didn't know as much about how the virus could spread from people without symptoms. And the messaging reflected that. Also, healthcare workers were having trouble getting their own supplies of masks. Remember, the shortage was so bad that in March, the White House asked construction companies to donate supplies of masks to hospitals.
But you are right, and we have to admit it, that mixed message in the beginning, even though it was well meant to allow masks to be available for health workers, that was detrimental in getting the message across right now. No doubt about it.
And I absolutely blame the government for the mess that happened. I blame the whole Trump administration for how horribly this whole situation was handled. And just listen to the broken logic of it. Hey, don't buy masks. They're not effective. And our medical workers need the mask to protect themselves and to protect others. Wait a minute. So I don't need a mask because it's not effective, but the medical workers need the mask. Well, if they're not effective, then why are the medical workers wearing them? Right? So the medical world still wanted the mask. The medical world was still going to require the mask. And the medical world was still going to put masks on people. That's what was going to happen in the medical world. Again, I talked about it. 22 years working in the medical world. 22 years. I put masks on people for all kinds of things. Flu, cold symptoms. Put a mask on. Put a mask on. Put a mask on. All right. Don't stay away from me. Put a mask on. Don't cough in your arm. Wash your hands. Stay 5,000 feet away from me. All right. That it was so common in the medical world. But even the messaging is, hey, you don't need one, but the medical workers do. So then, are they effective or not effective? I'm telling you, the way the American government bears much responsibility for confusion, mixed messages, and not being consistent and not bringing people together. And the government bears that responsibility. Let's see if they have anything else to say in regards to this subject.
Of course, masks don't totally solve the problem. Social distancing and hand washing are still important too, and not all masks are created equal. When you think about when and where to put one on, there are degrees of risk to consider. I talked with NPR health correspondent Maria Godoy about these issues. Hi, Maria.
Hi, Ari.
Masks stop the spread of the coronavirus. We know that. That's important. We want to reiterate that. At the same time, I've seen people express concerns. One common one is, people are worried that wearing a mask might limit oxygen intake in ways that could be harmful. Is that anything people should actually be concerned about?
No, not for the types of cloth masks or surgical masks that the general public wears. The fibers they're made of aren't dense enough to block the exchange of gases like oxygen or carbon dioxide. And these masks aren't so tight that air can't get in around the sides. Now, there is some evidence that wearing N95 respirators for long periods of time, like an hour or more, can reduce the amount of oxygen you take in. But those masks seal more tightly to the face, and the risk there is really for people who are predisposed to breathing problems like emphysema. So, and also really only medical workers should be wearing N95s because they're still in short supply.
You mentioned people with emphysema. What about people who have serious respiratory conditions? Is the mask calculation different for them?
Actually, doctors say people with these conditions especially need to be masking up in public because they are at greater risk for severe disease if they get COVID-19. Even if someone, relies on oxygen when they go out in public, they can wear a loose-fitting mask over their cannula, which is that tube that delivers air under their nose. And if someone with a serious respiratory condition is having a really hard time breathing through a face mask, they should definitely talk to their doctor, but they could try a face shield. These are plastic shields that attach to the top of your head, and they go down past your chin, and they wrap around your ears, and they can block incoming respiratory droplets, though it's not yet known how well they protect other people from the wearer.
What about exercising with a mask? You're breathing heavily, you're sweating, the mask sticks to your face. What's your advice there?
That is a legitimate concern. If you're doing something like running or biking outdoors and you're alone or just with the people you live with, it's okay to pull down your mask as long as you haven't been touching stuff along the way, like benches or rails. If you see someone coming, pull up your mask until they pass. Indoor gyms are tricky because we know people who breathe heavily are likely to expel more respiratory droplets, and they aren't going to disperse as quickly as they would outdoors. So you really have to weigh the risk for yourself there.
And let me ask about comfort, because people who are required to wear a mask at work all day say that after hours, it can become really uncomfortable. What advice do you have there?
Experts say it's okay to take periodic breaks from wearing a mask. Just make sure you do it when no one's around. Maybe, step outside first. And also try out different masks to see what's more comfortable for you, because a mask is only useful if you actually wear it.
You mentioned that you can take it on and off. We've also been told we're not supposed to touch our mask when we wear it. So how do you reconcile that?
Don't touch the front of the mask when you take it off. So you don't touch any infectious droplets it might have blocked. And instead, you take it off by the ear loops. And you wouldn't want to touch your mask if you're indoors, like in a store where your fingers might have touched, objects that have virus droplets from other shoppers. But if you're outdoors and solo and you haven't been touching stuff along the way, you haven't had a close chat with someone, it's okay to pull down your mask to catch your breath. As one doctor told me, nobody is 100% perfect with this. Just do your best.
NPR health correspondent Maria Godoy talking to Ari Shapiro. And just one more thing. A month ago, on June 3rd, the Republican governor of Texas, Greg Abbott, issued an executive order banning local governments from imposing fines on people who did not wear masks. Today, with ICUs in Texas nearing capacity, the governor did a complete 180.
This safe standard requires Texans to wear masks in public spaces with certain common sense exceptions.
He issued a new order that requires masks statewide in public places.
This requirement is not intended to be punitive. Instead, we just need everyone to do their part to help to slow the spread.
Additional reporting in this episode was from NPR's Scott Horsley and Allison Aubrey.
Yes. If you listen to what she was saying when she was talking about the mask and wearing the mask and what not to do, very reasonable, not a burdensome situation. Just wear the mask. There is benefits to it, to trying to protect you and trying to protect others. And then we have, look, it's just so crazy that all of this pushback, no mask, no mask, no mask, no mask. We're not going to follow the rules. We're not going to follow the rules. Now everything is exploding. Everything's going crazy. And then here in Texas, the very same governor who a month ago was like, nope, I'm going to prohibit anyone passing rules about masks. I'm not going to allow it. And then a month later, wait, what's happening? Are you serious? The numbers are exploding. People are getting sick. People are dying. The hospitals are filling up. Wait, what? Well, I wonder why. Oh, how did this happen? I wonder why. I don't know. I can't. Could it be that we did not follow basic medical advice? In 1918, they made it a requirement to wear masks for that pandemic. It's just insane how our world thinks today. But guess what? All the people who didn't want to follow the rules, all the people who disregarded the rules, they're not going to take any responsibility. They're not going to apologize, no matter how many people die. The government's not going to apologize for their broken handling of this. America's lost complete control of the virus. We had an opportunity to try to get it under control. We've lost control again, and now we're going to try to get it back. And it's because people simply wouldn't listen. People simply wouldn't follow medical protocols. That what they wanted was to make political points. They wanted to be argumentative, fight, be selfish. All they cared about was themselves. And you've seen the videos of people going into a grocery store being told to put on a mask, and they lose their minds. They start yelling. They start screaming. Why? Why? Over a mask. It's a simple matter. No, it's a governmental plot to destroy my freedoms and to burn the Constitution and burn the American flag and put up a communist flag. It's just the insanity that has run rampant through society. The insanity is spreading faster than the virus itself. And that is unacceptable. And that is horrible. And look, it's one thing for it to spread outside the church, but inside the church, this debate should be over. Care about other people. Love people. Do not kill people. Preserve and protect life. Let's do what we can. Let's be light. Let's be salt. Let's be an example. Let's demonstrate that we love people more than we love ourselves. That we love people more than maybe we're willing to do something that is inconvenient or we don't like, or it may bother us, or even if we're not completely convinced how effective it is. I stated it earlier today. Even if it's only 10% effective, is that not worth trying to stop the spread of this virus? Look, you can just keep disregarding and you can just say you don't care. You just keep doing that and convince everyone around you to do the same thing. You may not care, but if the numbers go up, things are going to get shut down. Things are not going to reopen. The economy is going to continue to plummet and be absolutely destroyed. And you can sit there and say, well, it's stupid to shut everything down. Doesn't matter what you think. Here's what you can do. Do everything in your power to help the virus numbers drop so that things can reopen. And then when they reopen, don't be a fool. Follow some basic rules. So there you have it. I wanted to just bring some more information in tonight to try to conclude this. I'm done talking about it. I know my email, people are already mad at me, but look, no, all the people who've been mad at me, they want to make political arguments. They want to make arguments, that they don't want to deal with the scriptural mandate. They don't want to deal with the scriptural, look, if you want to argue from me from a political standpoint, that's fine. I don't care. I'm going to argue from a biblical standpoint. Love other people. Care about other people. Don't kill other people. Preserve and protect life. View other people's lives as sacred and the sanctity of life, and don't want anything to do to die. And just care about the economy and people's well-being. And so if you have to do something that inconveniences you, you're supposed to be putting other people before you. With all the clear scriptural mandates that we have, this shouldn't even be an issue within Christianity. But nope, we're going to argue like we're President Trump. And if you're getting your marching orders from President Trump and you're a Christian, there's your problem. And that would be my problem. And if we're getting it from any political party. All right, I'll stop right there. Thanks for listening to this late night episode of the Theology Central podcast and trying to make theology central to the mask debate. God bless.